Addiction is a disease that changes the brain. Here's how. Our brain releases dopamine to reward us when we do what we need to survive, like eat, drink, and seek shelter, and when we make connections with friends and family. It feels really good, so our brain tells us to keep doing it again and again. Our brain dopamine level is around 50 on an average day. On our best day ever, like winning a beach vacation or getting that big promotion, our dopamine level soars to around 100. On our worst day, like getting fired or losing a loved one, our dopamine level only reaches about 40. Most of us live somewhere in that 40 to 100 range on a daily basis. Using alcohol or drugs can crank the brain's dopamine up to as much as 1100, 10 times more than the brain can handle. That's a reward so big it can physically start to rewire the brain, especially if we use substances regularly or are predisposed to addiction. The brain can then start to prioritize that drug over everything else in our lives. It gets worse. Once the brain is rewired, no matter how much of the drug we use, our brain will never reach that 1100 again and will start to decrease our natural dopamine production over time until we find ourselves needing the drug just to get up to 30, worse than our worst day ever, and leaving us with barely enough dopamine to get out of bed. At this point, we aren't using the drug to get high, we're using just to feel normal and be able to function. Everyone's brain chemistry and risk factors are different, but once addicted to a substance, our brain can crave it so intensely that it consumes our life. We can start making decisions we never would have made before. An addicted brain experiences intense, off-the-charts cravings. Through research using fMRI scans to look at craving activity in the brain, we now understand just how intense cravings for drugs and alcohol can be, even more powerful than our cravings for things we need to survive, like food and water. When craving activity was measured in individuals who were severely dehydrated, their desire for water was overpowering. Visualize the size of that craving as a baseball. Subjects who went without food for several days displayed basketball-sized cravings. The cravings for drugs and alcohol in the brains of people suffering from addiction measured up to the relative size of a baseball field. And for some, the intensity of those cravings didn't lessen until after 2 years of not using. So imagine you're in recovery. Your brain is screaming 24/7 for a substance you're trying to avoid for up to 2 years. This while your dopamine level is lower than most people's worst day ever. That's the science behind why recovery can be an ongoing, difficult process. But there is hope. The brain can heal. There are more than 23 million people living in recovery in the United States today. Each is traveling a personalized path of recovery through one or a combination of approaches: medications to help stabilize dopamine levels and reduce cravings, treatment programs, professional therapy, support groups, and self-directed change. Treatment works, giving patients the care, tools, hope, and support needed to recover from addiction and reclaim their lives. 1 in 10 of our neighbors lives with addiction. It affects lawyers, teenagers, first responders, retirees, our whole community. We all know someone who's been impacted by addiction. One of the best things we can do to help as a community is talk about it. Share our experiences, work together to halt stigma and break down barriers to care. Change our minds about what addiction really is: a chronic disease that requires treatment and ongoing support, just like any other disease. So let's start talking. Start a conversation. Save a life. ChangingMindsLarimer.org